Hello everybody, hello everyone, and welcome back again to my channel. I hope you do well on your endeavor, and without further ado, let's start to talk about the reproductive system. Now, the function primarily of the reproductive system is to reproduce human being, to make form of babies. Now, there are two portion of this, the male reproductive and the female reproductive system. So we're going to talk about the external and the internal structures of both system, like the reproductive organs of male and the female. Okay, let's start. For anatomy and physiology, so this is a brief review so you could refresh your minds of what is going on. Okay, and let's start first with your male reproductive system, the external structure, which include your... Okay, so you can see here on the picture, there is what we call the testicle, which is responsible for production of the sperm cell. Now, prior to that, it is protected by a corrugated skin. They are corrugated to protect, house, and warm or regulate the temperature of your testes, because they need that to have or to produce a stronger sperm cell, because they need that power or strength to go through the female organ, especially on the target organ, is the fallopian tube. Okay. Now, this is the scrotum wherein it protects your testicle. Now, talking about the testis, sometimes it could be only one because of the undescended testis, but it's still called the cryptorchidism. Okay, so we're gonna talk about that on your pediatric. Okay, next is the glans penis. This is the glans penis, which has the shaft and the crown of the glans penis itself. Okay, this is wherein is a pathway wherein the urine and as well as your sperm cell expel through your ejaculation and then your urination respectively. So male reproductive is have less affected with urinary tract infection, because the urethra is long as compared with female. Okay, so next to that, we're going to talk about your internal structure. Okay, so we already tackled the scrotum here, the testis. Now, there is like a tube-like structure at the top of your testis called the epididymis. The epididymis, which is a pathway for your sperm cell. Okay, and then there is also another pathway wherein it houses your mature sperm cell called the vas deferens. Now, the vas deferens, they are cut during your vasectomy or sterilizing the male. So they cut it because so the sperm cell will not go push through and expel on your urethra anymore. So it dies over here. Okay, and then it goes through the pathway through your seminal vesicle. This is another structure wherein it gives additional nourishment fluid for motility of your sperm cell. They need that strength to go through your female reproductive system. Okay, so it means this seminal vesicle is additional structure that helps to propel your sperm cell. And another additional structure is a chestnut structure called the prostate gland that is responsible for additional nourishment, same as your seminal vesicle. So it gives additional energy for your sperm cell to go through the process of ejaculation. Okay, now however, the prostate gland in some older people, they have a problem with that, they hypertrophy called the BPH. So when this get a problem like it swell or it get bigger, so that would be a problem. So it means it can push back your bladder here. So urinary frequency is a problem with the BPH. So that's why I had to assess for that. Okay, so this is your prostate gland, and however during the BPH they remove your prostate gland as well. So there is for during after the surgery there are risk for bleeding, so you have to note about it. Okay, now the prostate gland is here, then through your urethra and glans penis, and the sperm cell will go out. So that's the process of your ejaculation through the help of your sympathetic nervous system. Okay, now question here, when vasectomy is done to a male, does still have some fluid that will produce? Yes, definitely, because the seminal vesicle, the prostate gland, is still producing some fluids that will be expelled through ejaculation. So that's for your male reproductive system. Okay, now let's talk about the female reproductive system, which is the following. Let's start first with your external structure for female. So this is your the mons pubis, this part wherein there's a lot of pubic hair, as you can see. Then we have your clitoris. So here, now the clitoris itself is have a lot of nerve endings, so that's why pressure or touch will stimulate the female. So that's your clitoris. And then it has the head, the frenulum of the clitoris. So that's it. This also had the vestibule on the upper part. And then we also had the external urethral orifice. So that's where the urine is out, or that is the place we're in during the catheterization. So you have to be careful. That's not the vaginal opening, but instead you had to put the head of your catheter to the external urethral orifice. Okay, then we also have your labia majora, wherein is a fluff of tissue that covers the vagina. So that is the labia majora. And then the labia minora is parallel to your labia majora. It's like a small fluff again of tissue that covers your vagina. And then the vaginal orifice, of course, wherein the opening wherein the menstruation and wherein the baby is coming out. Okay, so wherein that is the opening of the female reproductive system. Then, as you can see, we have the perineal area, wherein this area of triangle is cut. Either it is cut during a delivery of the baby because the head of the baby is so big. If not accommodated, then they will be cut, so it will have more space for baby delivery of the baby. Okay, now looking back here, that the female reproductive system is risked for UTI because their urethra is more vertical and shorter. Now let's talk about the internal reproductive system of females. So this includes your cervix is here, then going through your uterus is here. That's the uterus, this area. And we also had your fallopian tube. This means tube is here, and there is called your ovary, wherein responsible for production of your egg cell. We're going to talk it one by one. So now the cervix is responsible for like its opening, wherein it indicates that the baby is pushing down so it to deliver, so it will open. So that's the one you're going to assess during delivery of the baby. Okay, next is your fallopian tube. Okay, parts of the fallopian tubes are this one. So it has 4 parts, which is your interstitial here, which is the proximal part near to your uterus. That's the interstitial. We also have the isthmus. The isthmus is here. The isthmic part wherein that is cut during your bilateral tubal ligation. So from here, the egg cell will not go through or be fertilized anymore. Okay, now next is the ampulla. The ampulla is the largest portion wherein, remember that the fertilization occurs. So the moment that your egg cell is produced, it will travel here to your ampulla, and then it will wait for the sperm cell to move and then meet over your ampulla on the fallopian tube. And the infundibulum is the most distal segment of your fallopian tube, wherein it catches the egg cell during the process of ovulation. Okay, so that's your infundibulum. Next is the uterus. The uterus is a hollow, pear-shaped organ located on posterior part of your bladder. Okay, of course, the uterus will serve as the implantation, wherein the zygote moves and implanted on your uterus, and it will grow there for 9 months. Okay, it will nourish, give nutrients, and will carry the baby for 9 months. The blood supply is from the ovarian artery, and nerve supply is from T5 to T10 and T11 and T12. Okay, next is the parts of the uterus. Okay, now the parts of the uterus includes the uppermost part, which is the body and the corpus, and that is the body. And then the isthmus is a short segment between the body and the cervix, and the cervix is the lowest portion. So it means this is your cervix wherein, and that is the isthmus is between the body of this is here, and then your body is here. Okay, that's for your uterus. Next, the layers of the uterus, we have the following. Includes the endometrium, the innermost layer. The myometrium is the muscle layer wherein it will contract during the time that the baby needs to be delivered, and it contracts stronger and stronger. Okay, and the perimetrium is the outermost layer of the connective tissue of your uterus. Okay, now the breast is also the external part, because it needs for supplying milk or nourishment for the baby after the baby was delivered. So it has glandular glands of adipose tissue. Now the more adipose tissue that it has, the more bigger it is. Okay, it has the acinar cells that produce milk for the baby, lactiferous ducts that transport milk to the nipple, and nipple transmits sensation to your PPG or posterior pituitary gland to release your oxytocin. Okay, remember, oxytocin is very important for stopping the bleeding, contraction and contraction of your uterus, so to stop the bleeding, and that is very important. And it has Montgomery tubercles, or that is a sebaceous glands on that area of the breast. So this is one. That will be all for female and male reproductive system. I hope you learned from that and would help you a little bit on this process. Thank you. Have a good day.